It's 1 minute left. After that, I will start the lecture. Okay, I see the response and see you guys can hear me. Okay. All right, let's start today's lecture. I'm Dr. Ying Lin from the Sun Yat-sen Memorial Hospital. I am a GI doctor. So today our topic is the basic methods of physical examination. And this semester, you guys are going into the learning of the diagnostic methods. And before all of this, you need to learn the basic methods for physical examination. And physical examination is the process of examining the patient's body to determine the presence or absence of physical problems. The goal of the physical examination is to obtain valid information concerning the health of the patient. The examiner must be able to identify, analyze, and synthesize the accumulated information into a comprehensive assessment. The 4 cardinal principles of physical examination we need to know. The first one is inspection, the second one is palpation, the third one is percussion, and the fourth one is the auscultation. This is the process teach the eyes to see, fingers to feel, and the ears to hear. And there are the fifth one. What is the fifth one? Is the smelling. So, equipment for physical examination, there are required equipments as well as the optional equipments. The required equipments include stethoscope, thumb brakes, pen light, tape measure, sphygmomanometer, reflex hammer, and safety pins. The optional equipment includes gloves, gauze pads, lubricant gel, nasal speculum, tuning fork, pocket visual acuity card, and ophthalmoscope. And the important aspects of physical examination in the physician part, we need to have the elegant appearance, decent manner, kind attitude, highly responsibility, and good medical morals. And also, before you touch your patient, we need to wash our hands, preferably while the patient is watching. Especially during the pandemic of COVID-19 nowadays. Washing with soap and water is an effective way to reduce the transmission of disease. And in your examination room, where is the bed placed? Should be placed. When possible, the examining table should be situated so that the examiner has access to both sides of the patient. An ideal arrangement is to have the table located in the center of the examining room, like this. So you can access both sides. So where does the examiner stand? The examiner should stand at the right side of the bed. Examine with one right hand. So also how to perform the physical examination. There are some important aspects that we need to pay attention to. We need to perform the physical examination in sequence. So this is what we call sequential, and also proper expose the patient. What's the sequence? We need to conduct the examination in the head to toe order. So first is the head, and then neck, chest, abdomen, spine, extremities, anal, genital, and nerve system. The patients will tire quickly when ask them to sit up, lie down, turn on your left and turn on your right, and sit up and lie down and back and forth. So we need to perform this physical examination in a proper sequence so that the patient do not need to sit up, lie down again and again and again. So we perform this sequentially. And the other important aspects, the patient should be made as comfortable as possible during the examination, and the patient should be properly draped. And exposing only the area that are being examined at that time without undue exposure of the other areas. When examining a woman's breast, it's necessary to check for any asymmetry by inspecting both breasts at the same time. After inspection has been completed, the physician may use the patient's gown to cover the breast not being examined. The care for the patient's privacy goes a long way in establishing good doctor-patient relationship. So this is what we need to pay attention to. The examiner should continue speaking to the patient and showing care to his disease and answer the patient's questions. It can not only release the patient's nervousness, but also help to establish the good physician-patient relationship. And there are some precautions that we need to take. The use of gloves could provide adequate protection when performing the physical examination or when handling blood soil or body fluid soil sheets or clothing. Gloves should be worn when examining any individual with exudated lesions or weeping dermatitis. Hands or other contaminated skin surfaces should be washed thoroughly and immediately if accidentally soiled with blood or other body fluids. All sharp items such as needles must be handled with extra care to prevent injuries. So I often tell my students to put the sharps in the sharp boxes, and before that, cap the sharps with the sheets and other things before throwing the sharps into the box. This can protect the cleaners for the other workers working in the hospital. A patient may be in isolation or on special precautions if he or she is suffering from a contagious disease. The first aspect is the principle for physical examination is inspection. It's a method of observation used during physical examination. It's the first step in examining a patient or body part. It includes a general survey of the patient's mental status, body movement, breath order, speech, state of nutrition, posture, gait, skin, and stature. How to inspect? Make sure the room is in a comfortable temperature and use good lighting, preferably sunlight. Look and observe before touching. Completely expose the body parts you are inspecting while draping the rest. Compare symmetrical body parts. So if you examine both parts of the, you need to examine both parts of the symmetrical body parts. The mental status and personal grooming. We need to talk with the patient to see does the patient look well or sick? Is he comfortable in bed? Does he appear in distress? Is he alert or is he groggy? Does he look acutely or chronically ill? This includes the poor nutrition. If the patient had poor nutrition, sunken eyes, and loose skin, this will be the indication of the end-stage disease. Does the patient appear clean? Is he or she comb their hair, does she bite her nails, or these are the first evaluation of the patient's mental status and personal grooming. And the answer to these questions may provide useful information about the patient's self-esteem and mental status. And for inspection, the first one, we need to see the posture of the patient. It may reveal significant information. If a patient has the congestive heart failure, he or she will sit in the chair the entire line, just cannot lie down. The patient with the body or tail pancreatic cancer will prefer to assume an upright or sitting posture. And this is to the posture to release the abdominal pain. So a certain posture will give you some clues. The positions of the patient at the time of the examination may suggest certain disease possibilities. And also a history of assuming certain positions to obtain relief from pain also may be of diagnostic importance. And the second principle for physical examination is palpation. The methods of feeling from the hands used during physical examinations. The examiner touches and feels the patient's body part with his or her hands to examine the size, the consistency, the texture, the location, and handliness of an organ or a body part, especially like in large organ or the enlarged lymph node masses, something like this. So we need to describe the size, the consistency, the texture, the location, and handliness. The palpation of abdomen is particularly important. And how to perform palpation? As with inspection, the initial step in palpation may be facilitated by distracting conversation or questions regarding the history. So we need to talk with the patient, keep communicated with the patient. It should be emphasized that during the preliminary stages, muscle relaxation is the goal. So ask the patient to bend the thighs and knees so that they could have a relaxation of the abdominal muscles. So the degree of muscle rigidity or resistance may be induced by light palpation. We should determine whether the abdominal wall as voluntary muscle tightening or actual rigidity. Muscle spasm cannot be relaxed by voluntary effort. So voluntary tensing of the muscle is brought about through fear or nervous. It can be overcome by proper technique. So always begin palpation in an area of the abdomen that is farthest from the location of pain. So if the patient has the abdominal pain at the lower right quadrant, and then we should start the palpation from the upper left region, quadrant of the abdomen. So the farthest part from the pain, this will relax the patient's fear or nervous and will not induce the muscle rigidity. And types of palpation. We have light palpation as well as deep palpation. And in the deep palpation, there are several different methods, including deep sleeping palpation, bimanual palpation, depressed palpation, and allotment. I will show you this later on. And first of all, I will introduce light palpation. Using the flat part of the right hand, or the pads of the fingers, not the fingertips, like this. Use the flat pad. And the fingers should be together. Put together your fingers. And sudden jabs are to be avoided, like this, sudden jabs, which should touch a patient's abdomen or the body part with the flat part of the right hand. So the hand should be lifted from one area to another instead of sliding all over the abdomen. Should be lifted from one part to another, but not sliding all over the abdomen. If you slide all over the abdomen, this is what we call massage, not light palpation. Okay, pay attention to this. The palpating hand should be warm because cold hands may produce voluntary muscular spasm called guarding. Engaging the patient in conversation often helps in relaxing the patient's abdomen musculature. And ask the patient to be in a supine position and to flex the thighs and knees. So this is the third thing for abdominal light palpation. Ask the patient to be in a supine position and flex the thighs, bend the thighs and knees. And this is the first step for palpation, abdominal palpation. And feel for the pulses, tenderness, muscular spasm, rigidity, surface skin texture, temperature, moisture, or mass size, location, hardness, motility, and the outline of the abdomen. We also do this to feel the precordial cardiac thrust, crepitors, frills, and vocal parameters. So we will perform the light palpation using the light palpation to do this. And rigidity is involuntary spasm of the abdominal muscles and is indicative of peritoneal irritation. And the rigidity may be diffuse. What we suspect the patient diffuse peritonitis or localized rigidity. This can be found over an inflamed appendix or gallbladder. So this is what we call appendicitis, or the inflammation of the gallbladder. In patients with generalized peritonitis, the abdomen is described as board-like. What is board-like is very hard. The rigidity is high and diffuse. So if the patient have a preparation of the GI tract, and also they will develop generalized peritonitis. And this is what we see in the generalized peritonitis, board-like abdomen. So this is the image show how to perform light palpation. We put our hands, the flat part of the hands, on the abdomen to do the palpation. So the second thing is the deep palpation. We use this to determine the organ size as well as the presence of the abdominal masses. The flat portion of the right hand is placed on the abdomen. Pressure should be applied to the abdomen gently but steadily. The patient should be instructed to breathe quietly through the mouth and to keep arms at both sides of the abdomen. And deep palpation, I will show you the figure. So this is the deep palpation. We often use our right hand on the abdomen and use the left hand to apply the pressure to feel the deep organ masses. This is the deep palpation. And also we perform deep slipping palpation. Deep slipping palpation, the examiner uses his forefinger, middle finger, and the ring finger, 3 fingers tied together, slowly, gradually palpate the abdominal organs or masses, slipping up and down from the right side to the left side. And this is the deep slipping palpation for palpating the liver as well as the spleen. It is often used for examining the deep masses or the GI lesions. Bimanual palpation. Use 2 hands, one on each side of the body part being palpated. Placing the left hand over the back of the organ to be examined in order to fix or elevate the organs. It may be helpful for the right hand palpation. It is employed during the process of liver, spleen, kidney, or abdominal masses examination. So this is by manual palpation. Use the left hand behind the right side of the patient's back to lift and fix the organ of the, such as the right kidney or the liver. So lift it and place your left hand on the back, and use your right hand to do the deep palpation of the liver, as well as the slipping palpation. So this is the bimanual palpation for the liver. And we also do the bimanual palpation for the spleen. And put your left hand on the left side of the patient's back to fix the spleen. And use your right hand on the left upper quadrant of the abdomen to feel if the patient has an enlarged spleen. Also, we can ask the patients lie on the right side and use your left hand to fix the spleen and use your right hand to do the deep palpation. So this is what we call bimanual palpation. So also, this is the deep palpation for the kidney. Because the kidney is the retroperitoneal organ, so we need to fix our left hand on the right back of the patient and use your right hand to feel if we can feel the enlarged kidney. So this is also the methods for bimanual palpation. The other method for deep palpation is the deep press palpation. The examiner uses his thumb or two to three fingers together to palpate with gradually increasing pressure in order to identify the deep organ lesions or localize the area of the abdominal pain, like the inflamed gallbladder, as well as the appendicitis. So we use the deep press palpation to identify the organ lesion, such as the pain produced by the inflamed gallbladder or the appendicitis. In patients with abdominal pain, the rebound tenderness should be determined. So what is rebound tenderness? It is a sign of peritoneal irritation and can be elicited by palpating deeply and slowly in a suspected area of the local inflammation. The palpating hand is then quickly removed. Deep press palpation, and then quickly remove your palpating hand. And if the patient, the sensation of pain on the side of inflammation that occurs on release of the pressure is called rebound tenderness. When you remove your hand, and the patient will show like this, and the sensation of pain occur when you remove your hand, and this is the situation what we call rebound tenderness. Deep palpation to identify the appendicitis, such as the appendicitis, and then quickly remove your hand, and the patient will show, very, very pain. And then this time, this is what we call rebound tenderness. Velociment. The examiner places 3 to 4 fingers together on the surface of the suspected abdominal area and push quickly and shuffling for several times with the motion from the wrist, but not the elbow. Okay, the fingertips might feel the abdominal organs are floating because it produces acidic waste. If the patient has ascites, the accumulated fluids in the abdomen will produce by the abdomen, and then the acidic waves will reflect back to your fingertips, so you can feel the floating organs. So that is what we call abdomen. Employed in palpating in the enlarged liver, spleen, or masses when the patient has ascites. So this is the method for the palpation for the patient with ascites. If he or she have the enlarged liver, enlarged spleen, or masses, you can use the abdomen method to feel the organ or the masses. It may also elicit uncomfortable of the patient, so be careful for doing the abdomen. Do not push too hard, because we have the cases that the patient, when we perform abdomen, they will have the rupture of the liver cancer. So this may be a very severe complication. So avoid doing this to push too hard for the palpation of the patient. So the third principle for physical examination is percussion. It's a method for tapping of the body parts during physical examination with fingers, hands, or small instruments to evaluate the size, consistency, borders, or the presence of fluid in the body organs. Percussion of a body part produces a sound that indicates the type of tissue within the organ. So we will pick up different sounds when we perform percussion. It is particularly important in examining the chest and the abdomen, the percussion. So, tapping on the chest or abdominal wall is transmitted to the underlying tissue, reflected back, and picked up by the examiner's tactile or auditory sense. The sound heard and tactile sensation felt are dependent on the air-tissue ratio. The vibrations initiated by palpation of the chest enable the examiner to evaluate the lung tissue to a depth of only 5 to 6 centimeters. But percussion is valuable because many changes in the air-tissue ratio are readily apparent when we perform percussion. So it is different from palpation. It is used to detect diaphragmatic movement, and the diaphragmatic movement to outline the lower border of the lung, as well as the upper border of the liver. So it is used to detect the diaphragmatic movement, the size of the heart, the edge of the liver, the edge of the spleen, and the ascites. So percussion is very useful in our daily work. Methods of percussion. We have two methods for percussion. One is indirect percussion, the other is direct percussion. For the indirect percussion, the examiner places the middle finger of the left hand, usually, if we use the right hand to do the percussion, firmly against the patient's surface wall, such as the chest or the abdomen, with palm and other fingers held off the skin surface. Only use your left middle finger like this to do the percussion. For the left hand, the tip of the right middle finger of the hand strikes quickly, sharp approach to the terminal phalanx of the left finger on the skin surface like this. This is the typical indirect percussion method. The motion of the striking finger should come from the wrist, but not from the elbow, like a robot. But you use your wrist, the striking force like this. The motion of the striking motion comes from the wrist, but not the elbow, okay? Deliver 2 to 3 quick taps and listen carefully. So this is the indirect percussion. And it should be performed from the upside to the downside sequence, from one side to the other, from left to the right. And we compare both sides, and up and down. So this is the important aspects of the percussion. And the quality of percussion, according to the characteristics of the tissue, amount of air containing and the distance of the organ from the skin surface, the percussion should include different quality. One is the tympanic. And also, we will have hyperresonance, resonance, dulness, and fretness. So these are different qualities of percussion. Tympanic. Percussion over a hollow air-containing structure, such as the stomach, will produce a tympanic, higher-pitched, hollow quality note. So this is the to see if the patient has a hollow air-containing structure. So this is tympani. Hyperresonance is the quality of percussion sound between the resonance and the tympani, such as in children, also in the pulmonary emphysema. If the patient has the overfreighted air in the lungs, so they will have hyperresonance. This can be seen in the COPD patient, chronic obstructive pulmonary disease. They have overaccumulation, overfilled air in the lungs. And when we perform indirect percussion, we have the hyperresonance quality. Also, resonance is a percussion over a structure containing air within the tissue, such as the lung, produces a resonant, higher amplitude, lower pitched note. And dulness. Percussion over a solid organ, such as the liver, produce a dull, low amplitude, short duration note without resonance. This is what we call dulness. Dulness occurs when the air content of the underlying tissue is decreased and its solidity is increased. So shifting dulness is often a useful method for identifying the ascites to see if the patient have the liquid accumulation in the abdominal in the abdomen. So we use shifting dulness to see if the air content decrease and the solidity increase. Okay, fretless. Fretless is a very short and high-pitched note. It's absolute dulness. Fretless occurs when there is no air present in the underlying tissue. For example, fretless is found over the muscle of the arm or the thigh. So if you want to pick up the fretless, the quality of fretless, and you can do the indirect percussion over the muscle of the arms or the thighs. So this is fretless. Okay, sounds produced by percussion, we need to record the binding like this, 1, 2, 3, 5, and also they have different quality and different location. When we perform the percussion for the lung, we may be able to pick up hyperresonance. The quality of hyperresonance is booming and air-filled lungs. If we do the indirect percussion on the upper left quadrant of the abdomen, we may be able to pick up tympani, such as the drum-like note of the abdomen, where your stomach locates. There are some air contained in the abdomen, in the stomach. So we may be able to pick up tympani. And the normal lung, in the normal lung, we perform indirect percussion or direct percussion. We can pick up resonance. It's a hollow-like note. And when we perform indirect percussion on the liver, we will pick up downwards, and it's a thud-like qualitative note. And if we perform the percussion on the muscle or the bone, we can pick up the flatness. So it's very flat, very solid. So these are the sounds produced by percussion, and we need to record all of these findings. Auscultation. This is the fourth principal methods for the physical methods. It's a method used to listen to the sounds of the body during a physical examination. It is performed by listening through a stethoscope and to evaluate the frequency, intensity, duration, number, and character of the sounds. So we use our direct ears or the stethoscope to do this auscultation. This is the stethoscope. You guys may be able to buy this from the internet or from the shops, and this is very useful in our daily clinical work. And we have different types of stethoscope. You will know how to use it later on when you go into the wards to communicate with your patients or to check your patients. And how to use the stethoscope. What is the do's and what are the don'ts? Warm the diaphragm or the valve before you place your stethoscope on the patient. Explain to the patient what you are listening for or answering the patient's question properly. So do not make the patient panic or nervous when you perform the stethoscope. And if you are a male doctor, you need to see the heart, to listen to the heart sound of a female patient. You need to have another colleague with you, another female colleague with you. This is the better things to do. So explain what you are going to do with your patient and answer the patient's concerns promptly when you perform auscultation and using a stethoscope to hear the heart sound or the any murmurs, or to check the auscultation for the lungs. Don'ts. Do not apply too much pressure when using the valve. Do not try to listen through coughing. So if the patient wore gloves, you need to drape the patient and to remove the clothes, and then place your stethoscope directly on the skin so that you can pick up the correct sounds that you need to identify. And how to perform auscultation. Eliminate distracting noises from the background, from the environment. Expose the body part you are going to auscultate. Use the diaphragm to listen for normal heart sounds and mouth sounds. Also, press the diaphragm firmly and use the bell to listen for abnormal heart sounds or murmurs. The bell, we can use the bell for listening for the cardiac disease. Hold the bell lightly, but press the diaphragm firmly. So these are the different tricks for using the stethoscope. Also, smelling is the fifth principle for physical examination. It's a method used to evaluate the relationship between the abnormal order from the patient and the disease. So some patient may produce some special abnormal order from the breath, from the other parts, such as the hepatic encephalopathy. The patient may produce some abnormal order. So this is the fifth physical examination tricks methods. The order is elicited from the exudates of the skin, mucosa, respiratory tract, GI tract, blood, and etc. The abnormal order may also provide important clues for the diagnosis of the disease. So do not miss these important clues from your physical examination. All these things are useful. And now the first part of today's lecture is all from here, and we will come back in 10 minutes. Now we start a 10 minutes break. All right? Thank you, guys. We'll come back in 10 minutes.